I lost a relationship. I lost my job.
All of my friends went on with their lives.
I was going in the bathroom and crying.
3.3 million people in Ontario are caregivers. Ordinary people who are caring for family members, partners, friends, or neighbors with physical and mental health challenges.
I started my journey with caregiving 10 years ago, and it was with my sibling, and she had a mental illness. I know it's affected me. In me getting my own mental illness, do I put myself first, do I put my family first, or do I put my sister first?
Every day you're not only grieving for him, you're grieving for yourself at what you've lost, what the potential could have been.
Because the problem is that if you asked me at year one, Andrea, have you got all this under control? I would have told you, I sure do. I have got this. If you said to me at the end of year two, are you still okay? I would have told you, we're okay, we're doing fine. The reality was we weren't. But I'm not going to tell you because nobody wants to say, I don't know what I'm doing and I'm inadequate and I don't think I can handle this and I'm feeling really stressed.
And that's when I fall apart, when I don't know what to do.
We asked caregivers what they need to support their own mental health.
I didn't feel like I was heard. I could tell that there was other stuff going on and I would raise issues, but you're afraid to raise them because you don't want it to affect their care.
I guess a bit of more empathy and active listening from the healthcare professionals.
Okay, so these people all say they can help me navigate, but none of them are really helping me navigate. The silos between healthcare and Ministry of Community and Social Services, that silos and how you bring people together is really, really, really challenging. And it's not just caring for the person who has the highest need. Sometimes the caregiver has a significant amount of need.
So you get all these books and brochures or our website with endless resource links, and you start and you just get lost. You're probably having trouble reading this. Take a deep breath, relax. You call this number and someone will talk to you. But the worst thing is trying to read when you're so stressed and tired and try to understand.
If hospitals can teach new mothers breastfeeding while they're in the hospital and diabetics how to give themselves injections, why wouldn't you say, so you are a caregiver and here are some things you might want to look out for. Here is a number of resources that you can access either online or in person or give them a call. It would really help everybody's mental health.
I think it would be important to have a discussion on roles and expectations of the healthcare system and a caregiver's role, because I think there's a lot of confusion.
I think respecting our role and respecting who we are as primary carers.
I would say respite care is very important. And I think that there should be a general feeling that you must avail yourself of respite care.
Make counseling and psychotherapy services, supports available to caregivers who are obviously in distress.
I would like to see more information spread out to just the general public, not just caregivers, but take out a billboard that says, a caregiver, drop off a meal. Take their dog for a walk. They want to help, but they don't know what to do.
So that overwhelming feeling is something that I think should be brought to the attention of the world, because we can all be in that position at any time, that we're a breath away, all of us, from being caregivers.
You definitely know one, because 1 in 3.5 people is a caregiver, so you know one. And here's what you can do to help.
If you are a caregiver and concerned about your own mental health, reach out for help. To find support, learn more about the Caregiver Wishlist, or to share your story, visit ontariocaregiver.ca.